Welcome to an Introduction to Tinnitus Retraining Therapy, a webinar presented by the Center for Hearing and Communication. I'm Audiologist Susan Adams, and I'll be your presenter today. I'm Clinical Supervisor of Audiology here at the Center for Hearing and Communication, which we refer to as CHC. I've been with CHC for more than 20 years and have been managing our Tinnitus and Hyperacusis Center since 1997. The treatment we provide here is called Tinnitus Retraining Therapy, or TRT. Before we begin, I'd like to thank the Acalis Foundation for providing funding for this webinar, one of a series we're presenting this month. During the webinar, you can submit questions using the toolbar on the top right. You may need to open the toolbar by clicking the red icon at the top right of your screen. You'll also notice that captioning displays automatically at the bottom of the screen. Today, I will be mainly addressing concerns concerning tinnitus, although I will touch on sound tolerance problems as well. I'm going to begin my presentation with some definitions, distinctions, and statistics, and then cover potential causes and associated conditions of tinnitus. I'll talk about the difference between hearing tinnitus, which is obviously the auditory part of tinnitus, and the being bothered by it, the non-auditory part. This will lead to something we call habituation, which is what tinnitus retraining therapy relies on for its success. Now let's begin. Tinnitus is a phantom auditory perception perceived in the ears or head when no external sound is present, such as ringing, buzzing, or hissing. And it's a condition. It is not a disease. The flip side of tinnitus is the experience of decreased sound tolerance. Individuals with tinnitus may also experience sound tolerance problems. However, these conditions can be experienced alone. The most common form of decreased sound tolerance is hyperacusis, which is pain or physical discomfort in response to moderate or even soft sounds that are usually well tolerated, such as the frying of food or unloading the dishwasher and putting dishes away. Misophonia, or what is also called as the 4 S's soft sound sensitivity syndrome, is a physical reaction of dislike to a particular sound or group of sounds, such as the sound of eating, sniffing, or clearing one's throat. Phonophobia is a subcategory of misophonia, where the main expression is fear. And recruitment is experienced as a sensitivity to loud sounds, which is a common side effect of sensory neural hearing loss due to structural changes in the inner ear, or the cochlea. Whereas hyperacusis, misophonia, or the 4S syndrome, and phonophobia do not reflect damage or structural changes in the cochlea. So how common is tinnitus in the United States? 50 million people have some degree of tinnitus. 12 million, only 12 million, seek special help. 2 million have tinnitus severe enough that the quality of their life is significantly impacted. It's the 10th most common complaint of the elderly. And the average age of an individual with tinnitus is approximately 59 years. It's been reported that 40% of individuals with tinnitus also report some degree of decreased sound tolerance, although I'd say from my own experience that it is probably higher than this. And a high percentage of those specifically reporting hyperacusis received treatment for this condition, about 27%. So what are the potential causes of tinnitus? There's a long list here, but what's important to know is that for the most part, there's no reported cause or event associated with the onset of tinnitus. For instance, noise exposure to loud noise is the most common cause of tinnitus, but research has shown that it only accounts for about 25% of cases. Many people are worried that the tinnitus might mean that they have an acoustic neuroma, which is a tumor on the hearing nerve. But it should be very comforting to know that actual ear pathology, including middle ear infections, which are very common, account for only about 7% of cases. Lyme disease is well known to cause hyperacusis and sometimes tinnitus, so it's important to have the test for Lyme disease, especially if you're a hiker. Many of my clients seen at the center report stress around the onset of their symptoms. High doses of aspirin, ototoxic drugs, and some antibiotics have tinnitus as a side effect, which is often temporary. And there are associated conditions. It's not uncommon to have other medical conditions in tinnitus. This does not mean that they necessarily cause tinnitus. However, it's not unusual to find in one's medical history some of these conditions. It's also easy to point to them when the first list has been ruled out, because that's what we do. We try to find the medical cause. So what do you do if you have tinnitus? First of all, do not panic. There is help. Despite the list of possible medical causes, for most individuals with tinnitus, there is no known medical cause. Consult an otologist, that's an ear specialist, just to rule out any medical condition and to relieve your mind that there is nothing medically wrong. Do not give up hope. There is hope, even if you've been told to, quote, go live with it, quote. Have a complete audiological evaluation and consult with an audiologist trained in tinnitus and sound tolerance management. These facts are not widely known, despite the long list of causes. And this is good news, and I do repeat, there is no known medical pathology or condition most of the time. This means that there's no ongoing significant medical problem with the auditory system that requires medication or surgery, even though it feels like it. In addition, tinnitus can be present with or without hearing loss, but it's most commonly associated with hearing loss, as you can see here. It's more commonly associated with hearing loss 80% of the time, although people with normal hearing can have tinnitus. So what happens when we have problematic tinnitus? We have two problems when tinnitus bothers us. There's an auditory part. We hear it, and there's a non-auditory part. It bothers us. This is the annoyance, our fear, our worry, our concern about it. So why do we hear it? Tinnitus is a side effect of the auditory system filling in missing information. When hearing loss is present, the auditory cortex is missing information, so it tries to compensate for that lack of information by filling in the blanks, and what we hear is noise. Even with normal hearing, we can have irregularities in the outer hair cells of the cochlea, the hearing organ, as we age, so there's missing information even with normal hearing. So why does it bother us? It bothers us because we cannot do something called habituation. And we see specialists primarily because of this non-auditory component, because of our reaction to the tinnitus of fear, of concern, and of worry. And secondly, we see specialists because we can't habituate to the sound of it. It's loud. It interferes. So what is habituation? It's happening all the time. It happens as I speak. Just like we don't know the refrigerator's on till it shuts off. The brain hears it, decides that it's neutral, and puts it to the background, so we don't have to pay attention to it. The brain constantly examines the sound environment and determines whether there is anything new, anything novel, anything threatening, and essentially turns it down if all is well. Habituation is why some people can live near a subway station, highway, or airport. These sounds become normal and usual. On the flip side, we can't habituate the sounds that annoy or frighten us. Tinnitus retraining therapy, or TRT, is the answer to how to live with it. But it's more than that, and it's far better. It speeds up habituation. It's based on the habituation model developed for tinnitus by Dr. Powell Jastreboff, a neuroscientist, and audiologist Jonathan Hazel in the early 1990s. It postulates that there is a non-auditory component involved, as well as the auditory component in the perception of problematic tinnitus. This non-auditory component is a strong connection with a part of the brain called the limbic system that is involved in memory and emotion, particularly significant negative emotion, as well as the autonomic nervous system, which is involved in the fight or flight response. This connection is the primary problem in tinnitus distress. This is a block diagram of the habituation model commonly used to describe what happens in the process of habituation. It's the auditory system that provides the source of the tinnitus signal, but it's the activation of the limbic system and the autonomic nervous system that's responsible for the persistence of tinnitus and therefore our distress. The first and primary goal of tinnitus is the elimination of annoyance and the connection with the limbic system and the autonomic nervous system. We call this habituating our reaction to the tinnitus. At this stage, although we still hear the tinnitus, there's a separation from our own felt feelings of distress about it. This leads the way to having more time away from hearing tinnitus. And the more time away we have from hearing it, the greater likelihood of the second goal occurring, which is the reduction in the perception, the loudness. And at this point, it becomes a non-issue. The elements of tinnitus retraining therapy include directive counseling, sound therapy, and time. Directive counseling is intensive education regarding the brain and habituation to totally demystify what tinnitus is, to make it a known in order to facilitate habituation. Sound therapy is used to interfere with the tinnitus signal and is usually used using ear-level devices or hearing aids where needed, as well as using environmental sounds. And it requires time. It takes time for the brain to habituate. And the process can take 6 to 24 months according to the particular person. CHC's Tinnitus and Hyperacusis Center was established first in 1997. It provides treatment for tinnitus and all sound tolerance problems using the TRT approach. We offer in-house and phone-based services as well. We offer a 15-minute initial phone consultation so that you can find out more about the program and get your questions answered. And referrals in your area can be provided upon request. And as you can see, our phone number in New York is listed on your page, 917-305-7751. And remember, this is so important, medical conditions are rare. You are not alone, and do not give up. There is help. Make sure to avoid silence. It's very easy for the brain to keep track and hear the tinnitus when you're in a quiet environment. Use sound at all times, even while you're sleeping. And particularly for those with sound tolerance problems, particularly hyperacusis, do not overprotect your ears. Do not wear earplugs to bed. do not wear earplugs when you're in soft or moderate noise, and contact us for more information. So I'd like to take the remaining time to answer some of your questions. So this first question, should I seek treatment now before my tinnitus is a real problem? I'm a real advocate of getting information as soon as you can regarding tinnitus, because the more information you get, the more it will help your reaction and reduce that strong connection with the limbic system. So I believe that it's best to at least get a lot of information as soon as you can. The next question is, what are ototoxic medications? Well, one of the most common ototoxic medications is a medication for cancer. Cisplatin is very well known to cause tinnitus. They're not necessarily ototoxic, but high levels of aspirin, and as I've said before, some antibiotics can at least cause temporary tinnitus, and it's important for you to ask your pharmacist regarding the potential side effects of the medication that you're using. Why can tinnitus be modulated with tilts and shifts of the neck? This is a great question. For some reason, there are a number of individuals who do notice changes in their tinnitus with tilts of the neck. It's also not uncommon for someone to notice changes in tinnitus with facial grimacing, and even sometimes eye movement. And I do not think that this is something to be concerned about. It's always important to rule out any kind of medical condition, but this is not an unusual experience. Why do you recommend against sleeping with earphones? I can't sleep without them. It's really much better to manage, if this is for tinnitus, or maybe even you've got a noisy neighbor, it's much better for you to manage your sound environment using sound instead of taking sound away. Whenever you're wearing earphones, it changes the natural kinds of sound that arrive to the auditory system, and the auditory system gets very interested when there's any kind of change. So one other reason for not sleeping with earphones and also not sleeping with earplugs is that once you take those earplugs out of your ears, sound is much louder. And is neuromonics effective? Do you offer it? Neuromonics is effective. We don't at this time offer it, although we have been looking into the possibility of providing it here at the center. Neuromonics is a treatment for tinnitus that grew out of TRT, and it uses a different type of instrumentation. It uses an MP3 player, and the signal that is used through the MP3 player, through the headphones, is filtered music based on your particular hearing. It is definitely a viable option, particularly for individuals who need more of a masking type of effect initially. Why is TRT effective for some but not everyone? For those who are looking for, and the only option that's acceptable is a medical cure, I would say that TRT might not be for that person. That person is often only accepting a medication or some potential medical solution for TRT, and TRT is not an instant type of treatment. It can take time. And although it's not unusual for people to notice changes in their tinnitus very early on and well before 6 months. Why is my tinnitus louder when I first wake up? I have many people reporting this, and it's very often because the background sound is quieter. It's usually quieter in the bedroom. I recommend that you have some kind of sound running all night that does not shut off, such as a sound machine, could be music. It could be a fountain. It should be some kind of sound that's steady, that doesn't vary in intensity. Can children experience sound sensitivity? They certainly can. There are a number of children who have been reported by their parents to experience problems with soft sounds, the sounds of eating. And this is that type of sound tolerance problem, which is called misophonia. Some people call it the soft sound sensitivity syndrome. However, it can occur in children. That's all the time we have today. Thank you for joining us. I will do my best to answer any questions we didn't address today. There were a lot of questions through email. We hope you found this webinar informative and would appreciate your taking a few moments to complete a short survey. It will appear on your screen as soon as you exit the webinar. You can learn more about our Tinnitus and Hyperacusis Center by visiting www.chchearing.org. If you'd like to schedule an appointment, call us at 917-305-7751. Thank you.